Summer COVID surge alert. Tri-state wastewater data shows rising cases. **** The COVID-19 summer surge. A new wave in the tri-state area. ****. As we step into the summer of 2025, a concerning trend is emerging. COVID-19 cases are on the rise across various regions, particularly in northern Kentucky, southeast Indiana, and southwest Ohio. Recent analyses of wastewater samples have revealed a notable increase in viral loads, as reported by Philip Graham, the Informatics and Surveillance Program Manager at Northern Kentucky Health. Graham explains, wastewater surveillance serves as an early warning system for predicting actual COVID-19 cases. This is because individuals often begin shedding the virus before they seek medical attention. He emphasizes that Kentucky is currently witnessing a rise in COVID-19 case numbers, which can be tracked through the state's health dashboard. While the current data shows a low number of hospitalizations and doctor visits, health officials anticipate that this situation may soon change. Graham points out that a surge in cases from July to August is not unusual. Typically, many people receive their COVID-19 vaccinations, particularly boosters, as winter approaches. This timing can lead to a decrease in immunity as the months progress, he notes. Given that we experienced a relatively mild winter regarding COVID-19, it's possible that many individuals have not been exposed to the virus for a couple of years. Consequently, their immune systems may not respond as effectively as they could. Graham reiterates that the guidance for preventing infection remains unchanged. It's never too late to get a COVID-19 booster. If you missed the opportunity to get one before last winter, you can still receive it now, and it will be beneficial, he advises. The most crucial advice we can give is to stay home if you're feeling unwell. We must avoid spreading the virus. If you find yourself in crowded places or traveling, wearing a mask is a wise precaution. In southwest Ohio, the Ohio Department of Health has reported that one wastewater treatment facility in the Dayton area is showing moderate and rising levels of the virus, while other facilities are either maintaining low levels or experiencing a decline. In southeast Indiana, 3 wastewater monitoring sites have been involved in tracking the virus, but currently, only one remains active, indicating low yet increasing levels of the virus. ***, what's next? As we navigate this summer surge, it's essential to stay informed and proactive. Will we see a significant increase in cases, or will the measures in place help mitigate the spread? Share your thoughts in the comments below. Are you concerned about the rising numbers, or do you believe the situation is under control? Let's discuss. COVID-19 summer surge. Rising cases in over 25 states. CDC update. As the summer months heat up, a disturbing trend is emerging. COVID-19 cases are on the rise in numerous states across the country. According to the latest data from the Centers for Disease Control and Prevention, CDC, at least 26 states and Washington, D.C. are experiencing an increase in COVID-19 cases. But here's where it gets concerning. The number of COVID-related emergency room visits for young children has reached its highest point since March. This surge in cases is not unexpected, as Dr. John Larpuk, CBS News chief medical correspondent, explains that we've come to expect a summer spike in COVID-19 cases, following a similar pattern to the winter surge. However, it's crucial that people don't become complacent, especially those who are vulnerable, such as the elderly, young children under the age of 4, and individuals with compromised immune systems. The latest COVID variants, dubbed Nimbus and Stratus, are no more deadly than previous variants, but it's essential to remain vigilant. The good news is that the current vaccines do provide protection against these variants, but the question remains, should you get a COVID vaccine booster? The answer is not straightforward, as the CDC has different recommendations than many major health organizations. For instance, the American College of Obstetricians and Gynecologists recommends that pregnant individuals get vaccinated to protect their unborn babies. Meanwhile, the CDC suggests shared clinical decision-making for healthy children and recommends that most adults aged 18 and older get a 2024 to 2025 COVID-19 vaccine, particularly if they're 65 and older or at high risk for severe COVID-19. So, where are COVID-19 cases growing? According to the CDC, cases are increasing in states such as Arkansas, Hawaii, Illinois, and Texas, among others. On the other hand, cases are likely growing in places like Alaska, California, and New York. As we navigate this summer wave, it's essential to stay informed and take necessary precautions. But here's the question: are we doing enough to prevent the spread of COVID-19, or are we becoming too lax in our efforts? And this is the part most people miss: the importance of ongoing vigilance and proactive measures to protect ourselves and our communities. The controversy surrounding vaccine recommendations and the role of individual decision-making versus public health guidance is a topic that sparks debate. We'd love to hear your thoughts. Do you think the current vaccine recommendations are sufficient, or do you believe we need to take a more aggressive approach to combating COVID-19? Share your opinions in the comments below. Summer COVID surge: should you get a vaccine? As summer unfolds, COVID cases are on the rise across the United States, prompting a crucial question: is it time to consider getting vaccinated again? With the increase in COVID cases this summer, many individuals are left pondering their personal risk levels and whether they should seek another vaccine dose. As of July 15th, the Centers for Disease Control and Prevention, CDC, reported that COVID cases were either increasing or likely increasing in 27 states, including Texas, Illinois, Kentucky, Virginia, and Ohio. In recent weeks, the CDC has also noted a rise in the percentage of positive COVID tests, particularly in the southern regions of the country. The current dominant variant in the US is N.B.1.8.1, which accounts for 43% of all new COVID cases. This variant is a descendant of the XBD.1.5.1 strain, which itself is related to the Omicron variant. Earlier this year, N.B.1.8.1 was linked to a spike in hospitalizations in China. Interestingly, this variant has been informally dubbed razor blade throat due to reports of painful sore throats among some infected individuals. Dr. William Schaffner, an infectious disease expert at Vanderbilt University Medical Center in Nashville, Tennessee, pointed out that sore throats have been a common symptom of COVID since the onset of the pandemic. He expressed skepticism about any significant changes in the clinical spectrum of COVID, stating, "I doubt the clinical spectrum of COVID has changed substantially." So, do you need a COVID booster? And when will the new vaccines be available? The recent surge in cases coincides with many Americans potentially going a year or more without receiving a COVID vaccine. In May, the Food and Drug Administration, FDA, requested that vaccine manufacturers update their COVID vaccines to target the LP.8.1 strain, which is another offshoot of Omicron that began spreading widely in 2023 and currently represents 31% of new cases, according to the CDC. However, these updated vaccines are not expected to be available until the fall and will likely be approved only for adults aged 65 and older, as well as children and adults with at least one underlying health condition that increases their risk of severe illness. For healthy children and adults seeking a vaccine, they may need to find an older version or pay out of pocket, with a single dose potentially costing as much as $140. Despite the rising cases, experts believe that population immunity, whether from vaccinations, previous infections, or a combination of both, may provide a buffer for many individuals at this time. Andy Pakosh, an infectious disease researcher at Johns Hopkins University, noted, "While we don't have a lot of high level of immunity in the population right now, because it's been so long, we may have enough low-level immunity to just make it a little bit harder for that virus to transmit easily from person to person." Weekly hospitalization rates have remained low, indicating that the new variant may not be causing severe illness. The current number of cases is significantly lower than at the same time last year, when the test positivity rate peaked at 17.9% in August. In contrast, the positivity rate for the 2025 season has yet to reach 5%. Prakash explained that it is not uncommon for COVID cases to rise during the summer months, as people tend to gather indoors to escape the heat. However, he anticipates that any potential summer surge will be minor. The variants have been around for a while and haven't caused any major surges up until now, he said. So again, I'm hopeful that if we see a surge, it'll be a low-level surge compared to previous years. Dr. Ofer Levi, who directs the Precision Vaccines program at Boston Children's Hospital and has advised the FDA, emphasized that individuals at high risk for severe illness should consider getting a COVID shot if they can find one. High-risk groups include older adults, individuals with weakened immune systems, pregnant women, those with underlying health conditions, such as asthma and heart disease. Levi stressed the importance of vaccination for those who haven't received a shot in over a year, as their immunity is likely diminished. If you're in a high-risk group and you're in a state where cases are rising, you may want to just get the first available appointment and get a shot to protect yourself, he advised. High-risk individuals can then consider receiving an additional COVID shot when the updated vaccines become available in the fall. Dr. Schaffner suggested that those in high-risk categories might also want to wear masks during indoor activities, such as going to the movies. On the other hand, healthy adults and children may have the luxury of waiting longer before getting another shot. If you're in a lower risk group, that's where things get fuzzy, Levi noted. I mean, if you want a vaccine and your healthcare provider concurs and you can get it. Dr. Michael Phillips, an infectious disease specialist at NYU Langone, mentioned that he primarily sees positive COVID tests among immunocompromised individuals and older adults. He reassured those who haven't received a COVID shot in years that they likely don't need to be overly concerned at this point. If you're younger, otherwise healthy, I think you're okay, Phillips said. If you have underlying pulmonary disease, if you're in an older age group, now that's a time when you should be really talking to a doctor and saying, gosh, should I be getting a booster for COVID? He also noted that the number of positive COVID tests at NYU Langone has decreased by 40% since February. Fatima Amika, a senior analyst at the Center for Outbreak Response Innovation at Johns Hopkins, anticipates that the current wave will peak around September. Schaffner added that another wave can be expected in late fall and winter, stating, COVID has two increases each year. Everyone is familiar with the winter increase that goes along with flu and RSV.